I'm Leo Jaramillo, and just like many of you, COVID-19 or the coronavirus has altered our daily lives. As a county commissioner and a Senate District 5 candidate, my concern has always been about the people of my community and how best to protect them. Keep in mind that while the virus is a serious health concern, especially for older adults or people who have chronic medical conditions such as heart disease, lung disease, and diabetes, it's important not to panic, but to be prepared. So how can you help stop the spread of this COVID-19? First and foremost, stay home. This means self-isolating and limiting person-to-person contact. This is the safest and most effective way to ensure you and your families remain safe during these difficult times. Wash your hands with soap and water for 20 seconds regularly. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. And don't touch your face. Frequently clean touch surfaces and objects using regular household detergent and water or cleaning products. If you're sick, stay home. So let's talk about the symptoms of COVID-19 coronavirus and what to do if you think you've been exposed. According to the Centers for Disease Control and Prevention, COVID-19 coronavirus symptoms range from mild to severe illness and death. These symptoms may appear 2 to 14 days after exposure. Possible side effects include, but are not limited to, fever, shortness of breath, chills, muscle aches, dry cough, congestion, runny nose, headaches, diarrhea, and fatigue. The CDC lists emergency warning signs for the virus as trouble breathing, persistent pain or pressure in the chest, confusion or inability to wake up, or bluish lips or face. If you develop emergency warning signs for COVID-19, call the New Mexico Department of Health hotline immediately. That number is 1-855-600-3453. Once again, that number is 1-855-600-3453. Do not go to the ER or hospital before calling the hotline, as you may spread the virus. If you have an emergency need that requires an ambulance, please call 911. Tell the dispatcher if you have any flu or COVID-19 coronavirus-like symptoms so that the ambulance staff can be prepared with protective gear. Before heading to the emergency room, please call ahead to Presbyterian Hospital. That number is 505-753-7111. Once again, 505-753-7111. Hospital staff will direct you to the appropriate entrance. Please wear a surgical mask if you have one, if not a bandana, when you're around people and before you go to the emergency room. So how can you and your family prepare if you don't or haven't done so already? The CDC suggests that you purchase at least 2 to 3 weeks supply of prescriptions and over-the-counter medications, food, cleaning supplies, and other personal essentials. Remember, being prepared does not mean stockpiling or hoarding. Recommended healthy food options should consist of a supply of bottled water, frozen fruits and vegetables, dried fruit, canned fruit and vegetables, canned or in a pouch tuna or salmon, frozen fish or chicken, lentils, eggs, nut and seed butters, nuts and seeds, pinto, black or kidney beans, dried chicos and pozole, pasta and rice, grains, oats, powdered milk, hard cheese, olive oil, and of course, red and green chili. The CDC suggests that you create a household plan of action which should include choosing a room in your home that can be used to separate sick household members from those who are healthy, caring for elderly household members and those with compromised immune systems, creating an emergency contact list, coordinating with your neighbors about emergency planning, establishing ways to communicate with family, friends, and coworkers, and identifying aid organizations in your community. The CDC highly recommends preventative actions. Avoid close contact with people who are sick. Stay home when you are sick, except to get medical care. Cover your coughs and sneezes with a tissue. Establish plans to telework if possible. If you have been furloughed or laid off as a result of COVID-19 or are self-quarantined or directed to be quarantined or have a family member who is quarantined, you may apply for unemployment insurance. Please visit the New Mexico Department of Workforce Solutions for information on how to apply for these benefits. As of now, essential businesses remain open. Pharmacies, grocery stores, restaurants by takeout or delivery or drive-through, banks, drive-through only, health clinics and hospitals all continue to operate. Only visit these when needed as to reduce the spread of this virus. But this may change at any time with a stay-in-place order or lockdown. While visiting any essential businesses, limit close contact with others as much as possible, about 6 feet. Don't touch any items you will not purchase. Cover your sneeze or cough. Wash your hands immediately after returning home. And clean all surfaces you might have touched on your way in. And most importantly, take time to thank your police, firefighters, EMS personnel, store workers, sheriffs, physicians and nurses, and others who are on the front lines fighting this disease. So how can you remain up to date on COVID-19 updates? If you have non-health related questions or concerns, you can call 1-833-551-0518. Once again, that's 1-833-551-0518 or visit newmexico.gov. Que Dice Radio provides COVID-19 updates Monday through Friday following the 7:30 morning news. Sign up for the EMS Emergency Alert System. Text your zip code to 888-777. Once again, that's 888-777. Download local news apps and turn on notifications from the Santa Fe New Mexican, KRQE News 13, KOAT 7, KOB TV4 on any smartphone or device. So what services are still being provided in Rio Arriba County for our seniors? All adult day care centers have been closed until April 30th. Home food delivery is being organized. Senior centers provide drive-up-to-go meals, which are brought to your vehicle. Meals on Wheels will continue to operate for those who normally use them. On Fridays, frozen meals are brought for the weekend. I hope this extensive COVID-19 coronavirus video will help to prepare you and your family for this challenging issue. If you have any questions, please feel free to contact me anytime. God bless you, your families, our first responders, doctors, nurses, and those on the front lines. Together, we will face this challenge and become stronger.